An African newborn has almost 10 times the risk of neonatal death compared to a baby born in Europe or the U.S.
It is heartbreaking, especially when you consider how many could be prevented. The good news is better care there, implemented by Rice University, is improving the birth rates. Health reporter Haley Hernandez brings us the story.
An estimated 1.1 million newborns in Africa die each year. African countries have the highest rates of newborn deaths, and they're almost always preventable. And this is where Rice comes in. Researchers Rebecca Richards-Cordum and Maria Odin head Rice's Newborn Essential Solutions and Technologies, aka NEST 360. It's an international alliance to reduce newborn mortality.
An African newborn is more than 10 times more likely to die than a newborn born in the United States.
Most of those deaths are preventable with known solutions.
Better medical care could ensure the survival of 75% of these babies. But with a harsh climate and few resources, many dismiss it as a lost cause. But these Rice researchers accept it as a challenge. Along with 22 organizations, including local engineers and government officials, they are laser focused on improving survival for small and sick newborns by 2030. So how will they do it? With tools that are standard in any American NICU, like blood tests for jaundice, but using modified inventions that eliminate the time and cost afforded to American NICUs.
So this device was designed to be very low cost. It's battery powered. It just uses a couple of LEDs, very inexpensive LEDs. The strips just use little pieces of paper and membranes to separate out the red blood cells, so we're able to develop a very low-cost tool to provide answers right at the bedside.
Or, considering that many newborn deaths come from hypothermia, Odin shows me this design to warm babies.
We developed this Celsy monitor, and from across the room you can see if there's a problem. It'll turn red and alarm if the baby is either too hot or too cold. So it's a very simple device, but it provides a service for the nurse that makes it easier for her to do her job and to intervene if a baby is cold.
This summer's trip is a vast change from the first time they walked through these hospitals.
Every hospital we visited had a room called the equipment graveyard, and it was full of broken equipment that couldn't withstand the harsh environmental conditions, the heat, the humidity, the dust, or people couldn't source spare parts. We're both engineers, we're both moms, and that trip was really transformational in wanting to partner with local clinicians, local engineers to improve that situation.
And they're definitely improving it, innovating ways to use what they already have, repair equipment on the spot, or create something new.
We've developed some technologies, but more importantly, we've identified technologies from existing manufacturers that can also be effective in this environment. And we've put them all together in the package of devices that are needed to provide small and sick newborn care.
And we've had manufacturers who've actually made improvements in their products that were causing them to fail in these harsh environments. And now everybody benefits because the product is better.
That equipment is now better for everyone. And think about this. For the past 5 years that they've been going, they've improved the lives of 100,000 newborns every year. And it all began with an idea here at Rice. I'm health reporter Haley Hernandez, KPRC 2 News.